we most commonly treat patients with amblyopia, which is lack of visual development during childhood, and we also treat strabismus, which is ocular misalignment. Strabismus, as I mentioned, is misalignment of the eyes. The eyes can turn in, they can turn out, they can go up, they can go down, they're not properly aligned. There are different causes. Some patients may be born with a tendency to develop strabismus, and that tends to be hereditary. It can also be acquired. It can be secondary to cranial nerve palsies. It can be secondary to thyroid eye disease. It can be secondary to trauma. So there are multiple causes of strabismus, and when we assess the patient, it's important to determine, because this may determine the treatment that will be appropriate for the patient. The symptoms of patients with strabismus will vary, and what really makes a big difference is at the age at which the strabismus developed. If a child develops strabismus and misalignment of the eyes at a very early age, probably before 7-8 years of age, they have the risk of developing amblyopia, but they do not get double vision because they tend to suppress the eye that is drifting. If a patient develops strabismus later on in life, whether teenage years or adulthood, they do tend to develop double vision, which is diplopia. And that is because the eyes are pointing in different directions. They already have developed vision, so they don't develop amblyopia. The vision is not affected, but they do suffer from double vision secondary to the strabismus. We have different treatments for strabismus depending on the etiology or the cause of the strabismus. In childhood strabismus, when the eyes are crossing, we can frequently try glasses if they're farsighted. In adult patients with double vision secondary to the strabismus, we can try glasses with prisms, and that helps alleviate the double vision. If the symptoms are not alleviated with glasses or prisms, then we can consider strabismus surgery, in which we typically reposition muscles and work on the eye muscles to change the position of the eyeball. The difference between strabismus surgery in children and adults is that, as I mentioned, for strabismus surgery, we reposition muscles to align the eyes. But in adults, we have the opportunity, if the patient is able to cooperate, to use adjustable sutures, which means that we perform the surgery and we place a slip knot, a sliding knot that we can adjust in the clinic to get the best possible alignment. I think this is important, especially when the patients have double vision, because we can do fine-tuning of the surgery. In children, this is a lot more difficult to do because they cannot cooperate for the adjustment in the clinic. There's some surgeons that may do it, bring the child back to the operating room to do the suture adjustment. I think Bascom Palmer is unique in many ways. I think from the strabismus point of view and the amblyopia point of view, which are the most common conditions that we see, I think we benefit from having the imaging technology that we have available here. We can do echography, which is ultrasound. We can do MRIs if we need to evaluate the orbit and the causes of the strabismus. If a patient has poor vision, we can consult retina specialists, we can consult neuro-ophthalmologists. So we have all the ancillary testing, and we have all the other subspecialties and all these experts that can help us in more complex cases. So I think all this makes Bascom Palmer a very special place.